Yeah, I was just curious about that because I know that some students do international electives, but I haven't known anyone to go down to the States to actually do it. What was your experience like when you got hired on for the oncology service?
So I think it was actually a pretty good transition because I did my last rotation there, like my last elective before I graduated, and at that time they knew they wanted to hire me. So coming there was like I had known everyone already, so it was just a transition from saying I'm no longer a student and that, the orders that I write are valid.
Right.
Yeah.
How were you, I guess, oriented to the service, and how did they know how to use you?
So I think most of that came through my rotation. So when I first met people in the team, I would explain what a physician assistant was. And my supervising physician was just very open to it. Like right away, he was comfortable delegating things to me and kind of seeing what I was comfortable with, what he was comfortable with me doing. Once I started working at Sunnybrook, I actually put together a small presentation, like a PowerPoint, and I did it for the nursing team. I did it as well in clinic, even though I don't work in the clinics, just so that the oncologist could be familiar with me. But it certainly helped that they had experience with me as a student as well.
Mm-hmm.
So I had a few weeks where I went to different oncology clinics.
Okay.
So even though I haven't gone back to clinics since then, I at least went to each tumor site just to kind of see what their typical treatments are like and what kind of cases they see, and to even just get to know the physicians.
And for those that aren't that don't have a medical background, what is oncology?
So oncology is the treatment of cancer. So it can be done as an outpatient, it can be done as an inpatient. Physician assistants can be in any of the settings. It just depends on what the needs are of the environment. So I work primarily as an inpatient oncology hospitalist PA, which is a long role, but basically it means that I look after cancer patients admitted to hospital.
Okay.
So any complications from their cancer or from their treatment are what our service sees. And we were doing hematologic oncology as well up until about 6 months ago. And so we would even see new leukemic patients come in and do their induction treatments.
And you did mention goals of care. So can you explain a little bit about what that means?
So goals of care is when you are trying to articulate what's important to a patient. So what are their values, and trying to match that with their treatment plan. Mm-hmm. And also kind of seeing, what is available. There are so many things so many avenues you can go down with oncology. There are several lines of chemotherapy available. There's all sorts of radiation, surgery that might be possible. But then you also have to look at the whole picture and figure out how much of it is actually going to make a difference, not only in lifespan, but also quality of life for a patient. Because there are many patients who, might go through treatment and get so sick that it's not worth it to them to go through all of that if it means just like an extra few days or an extra month. And whereas for some patients, they might think that they really want all the treatments possible, even if there's a chance of it actually, making life shorter for them. So it's kind of trying to figure out that balance with them, and figuring out, how far would they want you to go if they're deteriorating? Would they want you to take them to ICU or do CPR? So it's all those really tough conversations, and trying to figure out what's appropriate for a patient.
And what's been your interest in oncology, or what's always drawn you to that specific specialty?
I think it's the combination of really interesting medicine and having a really human side to it. So I really enjoy the fact that we see really complex cases. Sometimes you're seeing some of the sickest people in the hospital, but at the same time, you really get to know them. And, I love getting to know people's stories. And so I think that, there's always something so authentic about being able to go through the hardest moments of life with someone and making it easier for them, but also learning some really interesting medicine, but also like interesting philosophies of life from patients. And I think that's what drew me from like the first day that I did kind of that shadowing opportunity in first year of PA school. That's what's kept me going since then.
So what are some common conditions that you come across in oncology?
So we see a lot of febrile neutropenia, hypercalcemia of malignancy, we see sepsis, we see bowel obstructions, hyponatremia. We also see a lot of immune-related conditions secondary to immunotherapies that patients are going on now. So we see a lot of colitis from that. We see neutropenic enterocolitis as well, and spinal cord compressions or cauda equina syndrome. Those are kind of like our bread and butter.
And are you managing all of these conditions as they come across in the hospital?
Yeah.
Okay. And what are some more of the rare conditions that you do come across from time to time?
So because we are a tertiary care center, we see a lot of neuroendocrine tumors, a lot of paraneoplastic syndromes, a lot of like the more refractory leukemias and lymphomas. So we'll see a lot of people go through multiple inductions, and the complications get very intense throughout these. We see a lot of aplastic anemia as well, and APL.